Welcome back to the Morning Blend. With an aging population, there is a shortage of nurses both nationally and locally, and there are more significant shortages in mental health care. Our next guests know that it takes a special person to care for the most underserved populations. And joining me now are Jeff Munz and Lauren Hubbard, who work for the Milwaukee County Behavioral Health Division. Great to see both of you.
Thanks for having us.
I feel like I already know you because I watched these videos of you that are part of a campaign because of this critical shortage in nurses, particularly in the mental health or behavioral health division. So I'm super excited to meet both of you, and thank you for your work.
Yes, thank you.
Thanks,
Was it on your heart? So first of all, becoming a nurse is one thing, and wanting to care for other people, but then specifically to work with people who have mental health issues. Was that also something that you felt a calling to do?
Yep.
Yeah, so basically, yeah, I mean, I think that what ends up happening is that you find yourself drawn to a certain population and you just want to hop right in there and do the best care that you can for the people that are there. So initially, I think that I didn't want to go into mental health, but when I got started working in the facility that I work at, I found that it was really a great opportunity for me to use all of my drive and ambition to sit back and take care of the underserved.
Well, because I would think it takes a lot of patience because you're caring for people who are sick or injured, but on top of that, they have mental health issues which can affect mood, personality, their ability to understand maybe their own health issues. So I would think it's particularly challenging.
I mean, yeah, it can be challenging. At the Behavioral Health Division, we serve a group of individuals who not only have behavioral health issues, but they also are suffering from medical illnesses as well. So our nurses work really hard to treat the whole person. And not only that, but just to tie what we've taught that individual, the treatment that we've provided them, to also bring the family into that, because support systems are what every person needs in order to succeed.
What was your understanding of the videos that you were a part of, where you kind of told your story and why this is something that you chose to do? And why do you think this campaign is so important as we look for nurses to serve the underserved?
So the campaign, the main focus of the campaign is really to let the community know that we are an open and thriving hospital. We have patients that are regularly coming to our facility, and it's a specialty. It's something that we can sit back and really take care of above and beyond some of the other hospitals around our area. But to work in our facility, the campaign addresses some of the things that we're really trying to get with nurses right now, and that's somebody that has the right drive, the right ambition, the want to work with mental health patients. Like any profession, you have to have that desire to be in that profession. And not just anybody can work with an acute crisis type patient that we deal with on a day-to-day basis.
I would think. One of the things I was shocked to read is that the Milwaukee County Behavioral Health Division, that this facility is home to the state's only psychiatric emergency room. I didn't realize that it was the one and only of its kind. That's incredible.
Yeah, and some of the things that we do in our facility not only happen inside of the hospital in the emergency room, but we also branch out throughout the community. So the emergency room is something that other cities and states are coming to look and see what we're doing to see how they can best serve their population in a manner that isn't tying down medical emergency rooms for issues that we can assist our patients with in a better setting.
How do you tell other nurses perhaps, or just other people in general, how the type of nursing that you do, the mental health nursing, is different than being a regular RN or nurse?
What sets mental health nurses apart is we really get to treat the whole person. I mean, if you're somebody who wants to give back and to really take time out to be there for individuals in your community, that's what behavioral health care is for. Again, we're not only treating high blood pressure and diabetes, but we care for individuals who suffer from schizophrenia, bipolar disorder, all the way down to addiction treatment. So we have to tie in the family, tie in the community, bridge those support systems out to the community so that that person can be successful once they leave us.
Well, and I know you made a point in your video, both of you really did, about how important communication is. And you mentioned treating the patient, but also communicating with the family, who I would think is vital in continuing care, especially once a person leaves a facility like yours.
Absolutely. It's a part of breaking that stigma that we're doing our best to do. Not only educate the community, but to try to make people realize that mental health is something that everybody could face. It's something that we want to normalize so that people aren't afraid to go out and seek the treatment that they need.
Well, and the statistics all show that it's so prevalent that probably every one of us has at least one member of our family who suffers from a mental health issue. So I think it's wonderful that you're reaching out. In terms of applying, so if people are watching and they either have an interest in nursing or they're already a nurse and would consider this specialty, I know that you have a lot of perks or a lot of benefits that you offer people who would consider this field in terms of signing bonuses, even loan forgivenesses for people who have forgiveness for people who have student loans, also some flexible benefits as well.
Yeah, so what we're trying to do is it's a very competitive market, so we want to reach out to the new nurses that are coming on board and let them know that we're there to sit back and kind of understand that it's tough to go through college, and nursing school is not the easiest thing to get through. So at the end of it, once you can hire on with us, we want to sit back and kind of reward you for your hard work, and we want to sit back and continue to reward you as you work with us and give back to you, like you mentioned, you know, with sign-on bonuses and tuition reimbursements if you're ongoing, things of that nature. So
I think it's wonderful that you do that. A great way to recruit the best people like you who truly care about what you're doing and serving, as we said, the underserved. What's wonderful too is that you have a wonderful fair coming up. It is a nursing job fair on January 11th between 2 and 5 p.m. You're going to talk directly with the nurse recruiter if you visit. You can also chat with other people with the Milwaukee County Behavioral Health Division, which is your fantastic opportunity just to learn more. You can go to Milwaukee.gov/nursing to find out more about the nursing job fair, as well as some of the benefits that we talked about in nursing in this particular field. It was wonderful to meet both of you.
Yes,
thank you so much. We really
very much.
appreciate your time.